in practice is decubitus ulcers. If decubitus ulcers are found on skin, we consider the patient is having. Hello and welcome to my YouTube channel once again. Today we will be discussing another very important topic about the dysfunctioning of organs, and we will be going a bit further and we'll be discussing the individual organ system failure. It has been talked in my previous videos about multi-organ dysfunction syndrome, which was MODS. You can see the video over here. When organs are progressing from SIRS to sepsis and finally organs are failing, there is a criteria for each and every organ to label them as being failed. For individual organ system failure, we will be looking at each organ separately and we'll be discussing about the criteria for each organ, how organs are being said to fail. So let's begin. Very firstly, we will be discussing about the cardiovascular failure, and for cardiovascular failure I will be talking about the criterias which, if present, then cardiovascular system is deemed to be failed. The criteria are heart rate less than 54 beats per minute or symptomatic bradycardia, mean arterial pressure less than 49 millimeters of mercury, or mean arterial pressure greater than 70 millimeters of mercury but requiring inotropic support. Another criteria is when there is ventricular fibrillation or tachycardia occurrence and serum pH falling less than 7.24, but the requirement is with this serum pH your PCO2 needs to be normal. So the criteria, if summarized together, are heart rate less than 54 beats per minute or symptomatic bradycardia, mean arterial pressure less than 49 millimeters of mercury or 70 millimeters of mercury or more requiring inotropic support, then ventricular fibrillation or tachycardia, and serum pH less than 7.24 with normal PCO2. These were the criteria for cardiovascular failure, and one or more of the criteria discussed, if found, then cardiovascular system is considered to be failed. If we go further ahead and talk about the respiratory system and respiratory failure, if the respiratory rate is less than 5 or greater than 49 breaths per minute, makes one of the criteria. Partial pressure of carbon dioxide greater than 6.65 kilopascal, alveolar arterial gradient, which is also known as AA gradient, if greater than 46.55. Then finally there is another criteria which is ventilator dependent on day 4 in intensive therapeutic unit. If a patient is having respiratory rate of less than 5 or greater than 49 breaths per minute, if the patient's ABG show partial pressure of carbon dioxide greater than 6.65 kilopascal, if AA gradient is calculated to be greater than 46.55, or if the patient is dependent on ventilator on day 4 despite being in intensive therapy unit. These criteria, if found, are considered to be enough for respiratory failure. If we go further ahead and discuss about the renal failure, in renal failure we have urine output. If urine output is less than 479 milliliters in 24 hours or 159 milliliter in 8 hours, it's considered one of the criteria. If urea is greater than 36 millimole per liter, creatinine is considered significant if greater than 310 micromole per liter, and if the patient is dependent on hemofiltration. These criteria, if found, then a patient is considered to have renal failure. If we go further ahead and talk about hematological failure, then in hematological failure, if white blood cell count is less than 1 per millimeter cube, platelets less than 20 exponent 9 per liter, hematocrit less than 0.2%, or DIC, if any of the above discussed 4 criteria is found, we call it hematological failure, and DIC is very much common in practical applications. If we go further ahead and talk about the neurological failure, there is only one criteria, and that is GCS less than 6 in the absence of sedation. You have not sedated the patient, but still patient's GCS is less than 6. If we move further ahead and talk about gastrointestinal failure, if there is ileus which is persisting for greater than 3 days, if patient is having diarrhea for greater than 4 days, if patient is having GI bleed, if patient is unable to tolerate enteral feed in absence of any primary gut pathology, If any one of the discussed criteria or greater than one is found, we consider gastrointestinal failure. We go further ahead and talk about skin failure. It's the very common example in practice is decubitus ulcers. If decubitus ulcers are found on skin, we consider the patient is having skin failure. Then there is another failure, which is endocrine failure, which can be defined when there is hypoadrenalism or when there are abnormal thyroid function tests of patients who are usually admitted in a hospital and are receiving therapy. So these were all the failures of system. I hope you remember it. Thank you for watching.